All right. Hi, everyone. Thanks for joining us today. This is the Invincible Health Series with Dr. Vin. My name is Krista Gervon, and I'm the Communications Director at Princeton Integrative Health. And as always, I'm joined with Dr. Vinny Leonti. Well, it is officially 1 year later since the initial lockdown began with COVID-19. It's really hard to believe it's been a year, but we are starting to see a return, or at least the look of a return, maybe a light at the end of the tunnel toward our normal lives again, hopefully. So we're going to talk a little bit today about how our diet and lifestyle, has impacted what we have seen over the past year, and how we can use that as a lesson in our future. So I'm going to go ahead and start the questions with Dr. Vinny. And again, we'll obviously open that up to everyone at the end for any additional questions you might have. So just to begin, how has our diet impacted the body's response from what we've seen over the past year play out?
So, obviously diet and COVID, it's a very complex issue, but I would say generally that you want to decrease the goal in all of this with coronavirus is to decrease inflammation.
Right.
So any type of diet that's going to help do that, there are some diets out there that are branded as anti-inflammatory diets.
Okay.
Most of these diets have in common that they're low in sugar and carbs, high in plant phytonutrients, and that helps the body to make a lot of anti-inflammatory components. Carbs and sugar are actually inflammatory all on their own. So by limiting those, we limit inflammation in the body. And, by eating cleanly, if you will, organically as much as we can, keeping toxins down, that will also help our immune systems and our body's response to coronavirus.
Okay, yeah, that was a follow-up question I was going to ask you as to whether or not it matters if we eat organic versus non-organic or all natural or anything like that.
Yeah, I think organically as much as we can,
Yeah.
for sure. I mean, it's hard to do that 100%, but the more we can do that, the more we can avoid pesticides, herbicides, grain fed to, cattle, and, the better it is overall for our body.
Yeah.
Again, goal, decrease inflammation. The more you eat organically, the better you're going to be at reaching that goal.
Right. And why is it so important for us to have an anti-inflammatory diet as it relates to a virus or COVID?
Yeah, so COVID specifically, the major problem there is inflammation.
Mm-hmm.
People who are prone to becoming inflamed have the so-called cytokine storm.
Okay.
Where the inflammation just gets out of control. There's really two parts to that. What happens is that there really are two parts to our immune system. When the virus first contacts our body, our innate immune system, the immune system, kind of the primitive immune system, senses a threat, and it tries to just destroy it. I liken it to having chemical warfare.
Right.
It just starts throwing everything indiscriminately. That includes, bleach and histamine and all these other vasoactive substances, anything to kill it.
Yeah.
And then the secondary, the adaptive immune system, comes into play. The innate immune system activates the adaptive immune system, and then that's more like the precision guided missiles. They make antibodies and that kind of thing. Mm-hmm. So what happens when we are inflamed, the innate immune system doesn't react appropriately.
Okay.
It allows the virus to really establish a stronghold in the body. And then so when the adaptive immune system comes into play, there is just so much more virus to take care of that it goes into overdrive and ends up um, almost like a friendly fire kind of thing. It
Right.
ends up causing clots and vascular inflammation in our own body just because it's there's just too much of an inflammatory response in the second phase. So not enough inflammation initially to keep the virus at a manageable level leads to an overkill, really,
Yeah.
in the second phase. And yeah, problems for the host, for the, you know, whoever that human being happens to be. So if we can keep inflammation at bay and let our innate immune system respond appropriately, then there's much less likely to be a cytokine storm later on.
Oh my gosh. Thank you so much for all that information. I haven't heard a lot about the inflammation part of it, honestly. So that's just such good information. And would you say, I mean, even beyond COVID, eating anti-inflammatory diet, or, you know, diet with less inflammatory components would be beneficial for just regular life?
It would totally be beneficial for regular life. Yes,
I thought you
absolutely.
might say that.
You know, because inflammation is the thing that drives most chronic
Right.
illness. It drives heart disease, it drives cancer, it drives stroke, it drives dementia, all the feared illnesses that we have. You know, diabetes has a very strong inflammatory component. So, yes, eating anti inflammatory can help all of those things, and it's foundational. You
Right.
know, that is one of the main pillars that we drive home to people, that they have to eat an anti-inflammatory diet, whatever that looks like. It could be a Mediterranean diet, it could be, you know, for some people tend towards almost like a keto diet.
Right.
I mean, you have to be careful, you have to make sure you're getting the good nutrients. So I just tell people, you know, low in sugar and carbs, high in plant nutrients. You know, try to keep the starchy plants, you know, down somewhat. Um, you know, eating fruits, eat the color of the rainbow.
Yeah.
Every color is a different phytonutrient that people are getting, and they're all essential for our good health. So
So when we see, you know, those who were suffering from chronic illnesses like diabetes, like heart disease, you know, suffer the worst from COVID, you know, you can see that while eating an inflammatory diet throughout your life, when there's not the risk of this, you know, novel virus leading to a chronic illness, which then leads to having, you know, either bad reactions, or of course, you know, the ultimate bad result, which is death,
yeah.
which is what we saw a lot. So I think we have seen, you know, full circle why it's so important to keep, you know, keep yourself healthy by eating healthy, especially.
Yeah, I mean, I think what COVID has done is just highlight the dangers of this these epidemics hiding in plain sight. The epidemic of heart disease, the epidemic of diabetes, the epidemic of obesity.
Has.
You know, um, they're out there and they're killing people every day.
Yeah.
Um, but you know, we're so used to that that nobody's really paying much mind to it anymore.
Yeah.
Um,
Prevention, you know.
Now come along novel coronavirus, and it interacts with those other epidemics, and those are the people who are at highest risk for severe complications and death, unfortunately.
Really was a perfect storm,
Yeah.
unfortunately. Um, One second. Someone has a. Oh yeah, you're dropping
Yes.
truth bombs. To Katie would like to tell you, she loves this. Thank you, Katie, and I
Well,
agree.
thank you, Katie.
Um,
Yes, I'm trying to drop the truth bombs. I
there's
did.
truth bombs hidden in plain sight, so you know.
Um,
Okay, so just like, you know, how we started the conversation off, we are 1 year later now. We've seen what has happened. We've seen how diet is a major factor in, you know, people's reactions to the virus. Now that we're starting to we're starting to see a light at the end of the tunnel. We're going to be having dinner parties again, hopefully. We're going to be dining out in restaurants again soon, more indoor dining and all of that. And we'll be in the grocery stores instead of, getting delivery service. So how can we better, how can we shift in these ways? Dining out is, usually the time when we want to indulge and get, a little bit more, not care about calorie intake, not care about what we're eating, but what would you recommend as we move toward, going back to our normal lives in these scenarios? How can we make better choices?
Sure. Well, um, it's hard. We have to decide in each social situation, how much are we going to indulge ourselves?
Right.
Because when we go out socially, that's what we're going to do.
Right.
I'm Italian. I love eating with people. I love it. Let's go out and, have a great meal together. Can you make better choices? Yeah, obviously. When I go out now, I'm not so much ordering the steak anymore with my coronary artery disease. That's kind of a rare treat for me.
Right.
I'm more looking at the fish dishes. I'm more looking at the salmon.
Got it.
It's hard sometimes when you go out to know if you're eating organic or not. So, when I'm out, I don't worry about that. I leave that at home. I really think it's important though that we primarily, when we're home, eat the way that we've been talking, get the organic, get the, eat that plant forward diet. And, if you feel like you can't spend, organic tends to get expensive sometimes. You can go to the environmental working group.
Yep.
It's EWG, I think .org, but
yeah,
not 100%. Is that right?
I think it is, but you can Google we're going to say the Dirty Dozen, right?
The Dirty Dozen and the Clean 15.
Yeah, so you can Google those and it'll tell you, which ones you should definitely go organic and ones maybe you can.
Yeah, so you can do that. But yeah, for most people, eating a lower carb, lower sugar diet most of the time. And then when you go out and you're spending time with friends, indulge to the extent that you feel you want to indulge, and know that you're going to pay some kind of price for that. But hopefully, it won't be too bad. If you're being good most of the week, then probably it's fine. And for everybody, it's a risk-benefit ratio, obviously. So if you're diabetic, then you're going to have to make different choices than somebody who's not diabetic. So.
You did mention the Mediterranean diet earlier, and I was just thinking, there is the Blue Zone cookbook, and there's if you're hosting parties, you could always refer back to those. I mean, they've got recipes from all over the world, basically. So whatever you're in the mood for or anything like that, you can find really delicious recipes that are super healthy from that.
Do people know what the Blue Zones are?
Oh, I don't know. That's a good point.
I'll just say it since
Google the Blue Zones too.
Blue zones are areas in the world where people routinely live to over 100, and they are some of their characteristics are that they have very close-knit communities, a lot of social gatherings, a lot of eating together, that kind of thing. And their diets are all over the place because there's one in California, there's one in Italy, Greece, Japan. They're all over. So different cultures, different health systems, but the commonalities are usually, good food and community and being engaged. So it's important to be engaged. I think that's as important as what we're eating. I think being engaged, some type of higher purpose, if you will, helping other people, whatever you want, but being engaged in community. And that's been what's been so hard for people over this past year is we haven't been able to be engaged with each other in the ways we were before. So I am so looking forward to it.
It's such a good point. Not only do we want to shift with, making better food choices and improving our health, but we need to start checking in on people again and, becoming closer, even though we've been so far apart this whole time. And, you know, obviously thankfully we have technology that have kept us together in a way, but it's important to get back to that, you know, personal connection in person. So
Mhm.
good.
Yeah.
Very good point. Well, let me, I'm going to check on Facebook to see if we have any questions here. Colleen and Katie, feel free to unmute yourself, or you can type in the chat if you have any other questions. This was a great discussion. Thank you so much.
This was great. Thank you. I'm so glad I jumped on.
Oh, hi.
Yeah, we are too.
Hey, I miss you guys.
You too.
Thanks.
Good to have you on. Yep, Marcia just related, you know, that she can relate to a lot of what we were talking about. I'm sure a lot of people can, this, you know, in America in general. I think, you know, unfortunately, that's, like you said, they're all very common chronic illnesses. So.
Yeah. Yeah. So that's our mission, to try to wipe those out. So we need all the help we can get. Yeah,
for sure. But I have to say, just because I'm in the middle of the metabolic reset program, not to push it at all, but I haven't had, you know, I've been doing mostly just vegetables and lean meats and things like that, and I can already feel a difference too with, you know, energy and just, you know, just internally everything just feels a lot different.
Mm-hmm.
My normal diet contains more carbs and things like that, so, you know, even for a short period, you can start to see changes pretty immediately.
Yeah, people can you can see changes in people's metabolic parameters in a couple of weeks usually.
Yeah, absolutely.
It doesn't take long.
No.
So you can start to quell inflammation. And that's the other thing. Yeah, the message I want to get to people is, you know, even if you haven't been good up until now, you know, be good. If you just start on this, you can make yourself more resilient, I'll say, you know, decrease your inflammation, get your immune system working better. So increase your chances that you won't get it in the first place. And then if you do get it, increase your chances that you won't have a severe case. So.
And if you need help getting started, we are here. You know, I started this program here, and it's been really transformative for me, and I'm happy to share my experience with anyone. But, you know, there's tons of programs and individualized ways that we can help if anyone's struggling or wants to make a change moving forward. So thank you so much for joining us. Thank you, Dr. Vinny, as always. And we'll be back here next Thursday at 4:30. We don't know the topic yet, but we'll keep you posted.
Well, it's Brain Injury Awareness Month, so it's probably going to be something with
brain health, right?
We might, something with brain health. We might start out with brain injury, but yeah, but certainly for the rest of the month, we'll be talking about brain health.
Okay.
Okay.
All right. Thank you so much, Dr. Vinny. Thank you, everyone. We'll see you next week.
Okay. Thanks, everyone. Thanks, Krista.
Have a good day. Bye.
Bye.